name is Dr. Kenneth Hartigan-Go. I belong to the UP Vanguard class of 82, and I have the pleasure of introducing a topic within the Vanguard Leadership Series number 2, covering national security, and in this case, to talk about national health security. The goals for the covers the following items. First, you have to understand that health affects everybody, young, old. Eventually, we are going to get sick. Now, the question is, as students of UP and as cadet officers and cadets of the UPROTC and STP, to know what are the factors that creates this health insecurity. Secondly, we live in a very complex health system. What are the building blocks that can strengthen this health system for the public good? Third, a deeper appreciation by you on what is a secure health system that can translate to a healthier and a more resilient nation. Lastly, knowing all of these things, what can a UP student and a future professional do to contribute to a stronger and secured health systems? Kenneth Arrow, a Nobel Prize winner of yesteryears in the United States, published an article in the American Economics Review way back in 1963, and he already asked a very difficult question. Is healthcare or medical care and welfare, is this a commodity of trade or is it a public good? Somewhere in the middle line is a balance that we need to take into consideration. And this dilemma has been affecting many decision makers. And if we cannot get our act together, it's simply because we have a dichotomy of philosophy that makes our healthcare system insecure. What are the attributes of healthcare in the Philippines? First, I mentioned earlier, healthcare is very complex. And number two, the affordability of healthcare has always been a problematic question, coupled with the low purchasing power of our people. The third one is a weak health infrastructure that we have right now, and how easy is it to even access these healthcare services, including products. We were always told that the problems of healthcare cannot be resolved simply by medicine or studying medicine or clinical work or health services alone. We indeed have to have a stronger social determinants of health, which I will explain subsequently. And what is important for us to remember today's talk is that a weak nation is definitely an insecure nation. Weak in terms of healthcare, no? Health plays an important part, therefore, of the national security. For instance, how do we play a role in fixing inequities? Beyond healthcare, there is also food that contributes to the health of a person. Nutrition. Are we even secure? Do we have safe food? Do we have access to good nutrition and access to good healthcare? Now, what is important as well is the social determinants of health I mentioned earlier, which are the product of work by Lancet Commissioner for Social Determinants for Health, Professor Michael Marmot, have indicated that we need to place equal investment in the following. Beyond just providing healthcare, there is an education component. Good education will lead to people gaining good employment, and this good employment is going to give them some financial freedom or financial liberties in order to choose healthier lifestyle. Now, if you look at this social determinants of health, it's nothing to do with the medicines or going to a hospital or seeking a doctor's help, but simply by investing on the fundamentals, there is a large contribution already to healthcare. The other thing I wanted to share with you is that healthcare, as a discipline, as an industry, is not immune to corruption. And this, therefore, can also make our nation insecure by leakages of money, rent seeking, poor regulatory controls, and the like. In 1991, students of UP, you need to understand that there's the local government code. And in some way, the devolution of governance to local government, in part, has contributed to a fragmentation of healthcare. That it makes it difficult for disparate groups of people, uh, people in far-flung areas, to get access to quality education, quality healthcare, for that, as an example, because they are spread out in a geographic groups. Fragmented landscape can further be explained by uh, the attractiveness of well-educated health professionals seeking out migration for greener pastures outside of the country, and therefore denying our people some access to their healthcare services. The internal maldistribution is another big problem, where there are healthcare professionals refusing to work in far-flung areas because of the inconvenience, safety concerns, the lack of access to finances, for instance. And this can bring forth a fragmented system in our country. For people who are involved with the health professional work, there's for some of the many of them, they don't have a clear career pathways, and therefore they are choosing something that is going to give them more ambitious end goals at the end of the day. And with that, it will create some level of inequity. Poor people cannot access the kind of skills and competence that they possess. But again, in mapping our health professional schools, not all of them are in fact producing health reformists. Yes, they are effective in producing the competent health professionals to deal with diseases, to do a good job in quality care, but healthcare is something that we need to reforms over the time. And sometimes oversupply of nurses is what we see now, but they are mismatched to areas where they are needed the most. Professor and former Dean and Secretary of Health Alberto Romualdez, who has passed on earlier, has always emphasized the issue of health inequity, and he rightfully describes the phenomenon of the poor subsidizing the rich in terms of health insurance. Now, I guess all of you, being students of a certain age, could be dependents of your parents in the Philippine health insurance program. And if you reach a certain age, you may have to be paying and contributing to the health insurance that subsidizes the health care of the poor. This is important as part of a concept of solidarity. What is important to remember in this particular slide, with this number of families and population that we have in our country, but these are also dated numbers, no? The challenge is still principally the same. How do we reach the D and the E population at the base of the pyramid, which constitutes a large part of our population? And these people need more health care services but could not afford them. If you take a look at this particular slide, you will see on the skyline at the back, maybe a very cosmopolitan, urban-based system where buildings are there. But in front, you do see people who are squatters uh, along the rivers. Now, often, the rich can fully afford to pay for their own health care out of pocket, and they probably, because of their gainful employment, have generous health care. And the poor don't even have pockets. And important for us to remember is near poor and lower middle class in the middle can suddenly become very poor financially because in order to meet their out-of-pocket expenses for healthcare. Health inequities, therefore, is something that will make the country insecure, uh, particularly by they're not being able to get themselves health care. In governance, we found that in a system where there's no accountability, people who are doing management but has no management skill, and the presence of corruption adds to health inequity. From what I described earlier, there's a fragmented central to local government system between private and public health system is a form of fragmentation that leads to health inequity. The regulatory inconsistency in terms of leading to inefficient use of health technology is another component for health inequity. I think students of this university needs to remember is there is a difference between providing equality and equity. This is a slide that if you give everybody the same box to stand up, it's called giving them equal opportunity, but it is not, because some people are taller, some people are shorter, and that's the same again with healthcare, where you have to give more in terms of financial resources for the poor who could not pay out of pocket for their medical expense. So therefore, we are anchoring our philosophy in improving health equity and not just providing equality. A politician once said, a minister of health I met some years ago in Singapore, he says, politicians often don't speak the truth. For example, they would say they will promise healthcare is free and therefore vote for me, and then I'll give you free medicine. You know, healthcare is not free, including medicine. When it is given freely in the perspective of the recipient, there is a cost to that, and somebody has to subsidize or even pay to that. And I think we need to get more of our leaders in governance, including politicians, to tell everybody that healthcare should be invested judiciously and applied very carefully, because there is a cost to providing healthcare. WHO way back in 2019, no, and I recall even earlier than 2018, they have already identified what are the 10 global health threats affecting the world, and Philippines included. No, and top of the list is air pollution and climate change. Over time, this is going to affect our health systems, because diseases will then travel to hotspot area in terms of temperature, no, being hotspot. We also have the rise of the non-communicable disease. What are they? Cancer. We have respiratory diseases, cardiovascular diseases, obesity, and metabolic endocrine like diabetes as well. But global influenza pandemic was articulated earlier, even before the COVID hit us. No, so this means that they are spot on in terms of doing their forecasting. But look at everything else down below. Number seven, a weak primary healthcare system is going to threaten us and create this health insecurity in our country, including dengue fever and vaccine hesitancy, which we have seen recently. Now, remember during COVID lockdown, when it was so difficult to get admission to a hospital, the dilemma of the healthcare was, who do I prioritize? When I am confronted with a number of patients with similar COVID symptoms, I will have to make a decision who I will save first, because it is difficult now to get a hospital bed and even a respirator, and resources are very scarce. And this poses a dilemma. Unless we trained our healthcare professional, managers in the hospital service and systems to address this in the most equitable fashion, where ethics, compassion, and the rule of law follows, there will be chaos. And indeed, the healthcare professionals had a difficult time trying to assess who are we going to prioritize for use of these limited resources. And this aptly describes, now, who do I prioritize first? Somebody who's young, somebody who's elderly, somebody who's rich, somebody who is poor. Describe what I've been telling you earlier about health inequity. To understand better the complex health system, you have to subscribe to WHO principles of strengthening the health system by first understanding the six building blocks. There has to be a good governance structure and clear regulations and implementation. The workforce of the health professionals are people who decides on services to be given and what medicines to be prescribed. And it all boils down to coming together for a good information system. Telemedicine and telehealth was seen as a very important, critical, and relevant intervention during the lockdown, because there were many people who couldn't get to a doctor, to our clinic, to access healthcare. So telemedicine was being used as a consultation platform. But financing is an equal important part. Now, if you take a look at this, the health system is not the domain of medical professionals or healthcare professionals. It is everybody's business, including those working in other disciplines. Because of uncertain government relations, including corruption, changing the rules based on the personality of the leadership, this is in fact leadership, no, a problem that we see. the differences of opinion and conflict between what do we go first, so health or economics or trade, the absence of due process and consultation with stakeholders like yourself. A public, therefore, is at a loss on how to navigate the complexity of healthcare and how to make good choices for themselves. And therefore, we need to understand also the complexity of the pharmaceutical system. This system includes supply and demand balance, ending with the consumer seeking out what they can afford, what they are to take. But there are players in the middle who decide on who takes what. Now, another aspect of health security problem is that the reality of counterfeit medicine, and though it exists all over the world, they are global. They are a threat to healthcare. Imagine taking a fake medicine, this medicine entering your body, and you are getting sick and not getting well. And local examples have shown us that even amoxicillin, which is an antibiotic available in our country, this is a local experience. They have detected fake products. One is authentic on the right. The right side, you will see the counterfeit medicine. But what's the difference? Can a layman identify what's the difference? Apparently, there are ways to tell that, and regulators and inspectors can do that. And we have to invest on them to do the job properly. Now, I recall Secretary Alran Bengson years ago mentioned that the solution to healthcare problems are not found in medicine or the science of medicine. It must be brought to the doorsteps of business and to the doorsteps of politics. And this is where I thought the students like yourself, coming from different fields, some of you will be entering the healthcare, some of you are going to law, economics, business, marketing, or simply in science. Each one of you has a role to play in the complexity of the healthcare six building blocks. Engineering as well can play a role, social scientists, data science and computer system, people working in finance and economics do come together to play a role. Again, what is the message here? Health is too important to be left to the doctors, nurses, and other healthcare professionals to manage, because you need an integrated, it's everybody's business, whole of nation approach. There is something for everybody in this talk. You may be entering into different fields, and that's okay. But as long as you remember that one day you will get sick, your relatives will get sick, and you will have to find ways to access healthcare that can be very expensive if there is nobody putting a governance structure and regulatory systems to check for quality and the control of pricing. So universal healthcare, it's a law signed in 2019. What universal healthcare means is that it is not a matter of just increasing enrollment of our people where they pay a premium and the money goes to a pool, and it becomes a financial risk protection mechanism. It is not just increase in coverage of numbers and their diseases, but it also involves quality of care and cost-effective measures, the judicious use of service and technology. A lot of this demands prevention and public health intervention. So we hold the Department of Health and the Philippine Health Insurance Corporation accountable for their good and poor performance. But the end of the day, you must remember what is our role to help society. We should not let the poor subsidize the rich for their health care and the poor neglected in terms of their health. That's not going to make our nation strong. So the solution that I'm proposing, and I hope you take it in good faith with you after this talk, please do more in terms of patient education and do more to empower patients so that they can make good choices. And what should be the UP students later on as a professional? What should be your response? You could do activities in the service of the campus where you're in, depending where what campus you are. Look for the gaps and intervene. It could be as simple as healthier food in the cafeteria, or doing community surveys, or medical missions to help uh, groups in the community where they have no access to healthcare, the health teams that you can do for your extracurricular activity, plus talking to your professors on how health teams can be integrated to the study that you're in, even though it's not related to medicine. Externally, you can do outreach program looking for better outcomes And when you are a professional, look for ways to improve the reforms through reforming the system. Okay, I end my talk here, and I hope this 20 minutes or so of talk inspire you to think through that health is everybody's business. We have a role to play in improving the healthcare system. Okay, thank you.